Thank you, Madam Chair. Thank you, Secretary. It's a pleasure to see you and have you here with your experience. I want to talk about mental health. You've talked about a lot here today. Last session, we passed the Bipartisan Safer Communities Act. And last session, I was able to get the Mental Health Matters Act out of the House, not in bipartisan fashion, not able to get it through the Senate. So first, on the Bipartisan Safer Communities Act that was enacted, any feedback you have so far in your enactment, trying to get more of those, I know it's early, resources to the schools. And I put this in the context of two things you've mentioned. For years, I've gone out to school districts in my district, in the San Francisco Bay Area. It's a very diverse district, very wealthy districts, very poor ones. The two things I hear regularly from rank and file educators, administrators and teachers is first your comment about respect. Young people who say they chose to be teachers in a high cost area, like where you're from, and their frustration is their passion for it, but their lack of respect from the larger community and their mental health. So I regularly hear from administrators and teachers and parents, what they need is more counselors. So what do you see as successes, early successes, in Bipartisan Safer Communities Act and on the Mental Health Matters Act, and continue to have discussions with my friend, the chair, on how we could do more around this, about attracting young people in the mental health fields. Since parity in the ACA, we have over 300% increase in adults and kids asking for mental health resources. We have a, unfortunately, inverse response from people choosing to go in the field. I recently had a meeting with some people who have $350,000 worth of debt from the Wright Institute in Berkeley, California, near my district. They have no professional lifetime of actually getting that. So the two questions are, in the first bill, what do you see as successes, early as it may be? In the second bill, how do we deal with the dilemma of the good news is stigma is getting healthier about particularly young people for accessing, but we have these huge demands and we don't really have a thoughtful way to get young people to go into the profession to meet the needs.
Thank you for that. And you know, I feel optimistic, sir. You know, career pathways and mental health support for students seems to be something that everyone agrees needs to happen. The Bipartisan Safer Communities Act provides a necessary funding to help double the number of social workers, counselors. It provides the support and immediate needs that our schools are having. Teachers, principals, parents, they all agree that these dollars are needed. Red and blue states, it's something that we know we need to do better, and thankfully the funding is there for that. So I am seeing this becoming an issue that unifies people and brings people together around the needs of our students and our educators, and I appreciate you mentioning that. I recently spoke to teachers at the Department of Education just for a focus group, and they said, you know, please don't forget we're dealing with the same mental health issues our students are facing. Sometimes we have displaced trauma, so please make sure that your plan includes us. I respect that. With regard to the shortage, we have to think outside the box. If we do what we've done, we're only going to get what we've gotten, and that's not good enough. We have to create pathway programs. We have to work with our higher education institutions to work with K-12 districts to find pathways and start tapping our freshmen and sophomores in high school and asking them to consider a career in the mental health space and provide pathways for that. Our Augusta Hawkins grant does that. The work we're doing around apprenticeships does that, and we're continuing to look for ways to lift up examples of where that works.
To follow up on this, we've got great research on, I mean, in the last 20 years, we've learned more about neuroscience and the development of cognitive development successfully. Recently talked to Susan Lin, a Harvard researcher who wrote Who's Minding Our Kids? The Effect of Social Media. Another wonderful researcher at Stanford, another woman, wrote Dopamine Nation. I meet with her next week. So we have all these this amazing knowledge, unlike anything probably in the history of our species. But we're not taking that research and deploying it for some of the reasons we just mentioned. What can we do with this committee in a bipartisan fashion to work with you to get that kind of overview?
You're absolutely right. One of the challenges we have is turning research into practice. And what we're trying to do is provide guidance in real terms and make sure we're listening to educators, parents, so that our guidance is reflective of their needs, not policy at a 50,000-foot view level.
Thank you. I yield back. I hope I get a gold star.